guys, student nurse Emily back again with another instructional video on how to do a nasogastric tube insertion. So the first thing that I'm going to do is check my doctor's orders, make sure that this patient is supposed to be getting a nasogastric tube. I would gather the supplies that I need, enter my patient's room, wash my hands, introduce myself, educate the patient on nasogastric tube insertion. It may cause some discomfort. I'm going to need them to follow my instructions for an easier process of making sure the tube goes down and it's in the right place. So when I say to swallow, 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 they need to swallow. I will assist them to lean their head forward so that the tube is able to go down the throat successfully and more easily. So I would educate my patient on all this, and then I would raise the bed to a working height for myself. So here I have a nasogastric tube, and then I'm going to put clean gloves on. These gloves look really big, but this is what I had in my kit. So here we go. So slip these gloves on. They are exceptionally big. Your gloves are not supposed to be this big. But just for the point of this video, you would wear clean gloves. So the first thing that I'm going to do is I'm going to measure from the ear to the nose and then mark that and put the nose to the xiphoid process. And then once I do that, I would mark that on my tube with a Sharpie, a piece of tape, whatever you prefer to use to make sure you know how far to put this NG tube into your patient. So some patients may prefer a certain nostril, some may not. It's polite to ask your patient which they prefer. If they don't prefer one, then usually just pick the one that is at the best angle for you. So in that case, I'm going to pick the left. So I'm going to tell my patient that I'm going to start inserting. Once I start inserting, I can say swallow, 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 swallow. If my patient is able to have water, I will offer sips of water. Once I know that my tube is around the back of the throat, I will ask my patient to tuck their chin to their chest. This will facilitate the entering of the naso tube easier. So tuck your chin to your chest, please, and swallow, 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 swallow. All right, so I'm going to keep going because I measured to 45 for this patient. So enter, 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 enter. All right, now that we're at 45, my patient is now comfortable. You may need to tape this to secure it. People can easily pull this out if it's uncomfortable for them. And at this point, I would need to check the gastric. I could ask my patient to open their mouth and make sure that the tube isn't collected at the back of the throat. I would need to aspirate the gastric contents of the stomach and then flush with normal saline or tap water. So you would use, I don't have one in this kit, but it's an irrigation, and you basically pull 30 milliliters of, or however much gastric content, and then you would flush with tap water of 30 milliliters or 30 cc's. And then you would attach this to whatever kind of nutrition that the patient may be getting. But before doing that, this patient would need to be ordered a chest x-ray to make sure that the tube is actually in their stomach and has not entered their lungs. So once that happens and the patient receives a chest x-ray and that they know this patient's NG tube is in the right place, you can attach this to suction. If they need suction, you can attach this to nutrition if they need nutrition. This is very useful for a lot of patients who have had abdominal surgery or they're having any kind of GI upset and they can't receive nutrition orally. Other than that, I would make sure that my patient has no pain or discomfort. I would lower the bed, take my gloves off, which are very easy to do with these gloves on, wash my hands, make sure the call bell's in reach, and make sure my patient's okay. But other than that, this is potentially what the NG tube would look like minus some tape around the nose to make sure it's secured. Alrighty.